everyone, I'm Dr. Perganti with Advanced Spinal Care in Onalaska. And today I just want to take a few minutes to talk to you about low back pain, and more specifically, low back pain due to a bulging or herniated disc. Now, low back pain is probably one of the most common conditions that we see in the US, and a bulging or a herniated disc is probably one of the more common causes of low back pain. So chances are when you go to your primary, you are not going to be a candidate for surgery. So your physician is going to prescribe opiates, muscle relaxants, or maybe over-the-counter NSAIDs like ibuprofen. And if the pain persists, maybe they'll do a round of cortisone shots, or sometimes they'll go in and they'll even burn those nerve endings. And if all that fails, maybe you'll be a candidate for surgery. Well, unfortunately, surgery comes with its inherent risks. And what many do not know is that low back surgery has a very high failure rate. So high that there's now a diagnosis known as failed spinal surgery syndrome. What all these first-line treatments fail to address is they don't ask what caused the disc to fail in the first place. What's the underlying cause of this problem? Well, what if I told you that your low back problem may actually be due to a problem up here in your upper neck? Hang in with me for just a second, okay? Let me explain. So your postural control center, the area of your brain that controls your postural muscles hold you upright against gravity, okay? They start up at the base of your skull, they run down the length of your spine, and they eventually attach to the crest of your hips. Well, that postural control center is located up here in the brainstem. So what we find is that when we have a misalignment up here, it'll create a muscular imbalance from side to side. And what will happen is one hip will pull up and it'll look like you have a short leg. When you're standing, one hip will be higher or lower and the body begins to twist and compensate. What this does is this puts a lot of strain on the joints and the discs in your low back. And over time, that wearing and tearing can lead to so much strain that the disc loses its integrity and it begins to bulge or herniate. Let me give you another example here. Imagine I have a water balloon between my hands, okay? And I go like this. What's going to happen to that water balloon? It's gonna bulge or herniate to one side. So what we do in our office is we correct the misalignment up here, and immediately what we find is that the hips will come level, the pelvis will untwist, the body comes back to a balanced position, and what this does is that takes the strain off the joints and the disc in the low back, okay? So what we're doing, again, going back to that water balloon, is we're doing this, okay? So if you would like to have your spine checked to see if your low back problem may actually be due to a problem up here in your upper neck, give my office a call. I'd be happy to set up a consultation with you, or go to my website, lacrossenukachiropractor.com, for more information.